Episode 479. What could go wrong? Covering high-cost claimants with stop-loss reinsurance. This is a slightly advanced conversation I'm having today with Andreas Mang and John Camire.
American healthcare entrepreneurs and executives you want to know. Talking. Relentlessly seeking value.
This show today, for sure, it's for plan sponsors and anyone on or about plan sponsors. But also listen if you are serving high-cost claimants some other way, because what you'll learn here today is some insights relative to how plan sponsors go about making sure they can pay you. Like if you work for example, some clinical organization. There's a, 101 starting point of this conversation if you need it on stop loss, which is episode 478 from a couple of weeks ago. This show is the, let's say, 201 level conversation that I'm having with Andreas Mang and John Camire about, as I said, stop loss insurance and stop loss insurance considerations. And I'd like to start here. If you're a very large employer, you've got 10,000 plus, say, plan members, the best stop loss coverage terms are going to be very, very different than if it's a smaller employer with 400 or 500 employees. So this is not a one size fits all, and this is really relevant, especially since stop loss coverage is a big ticket and an extremely crucial decision, which is why the first piece of advice offered in this show, which is certainly a carry-on from that earlier episode I mentioned, 478 from a couple of weeks ago, the one piece of advice to rule them all, get a very, very experienced broker/consultant who works with self-insured plan sponsors of your exact size and has for a while. That is the one rule to rule them all. Get this number one piece of advice right, and you'll do a whole lot better with the rest of the to-dos that Andreas and John share today, which are, piece of advice number 2, get a whole bunch of stop-loss coverage bids from different vendors and get them every year. Number 3, piece of advice, pay attention to a few key contract provisions. There are 4 contract provisions to be really watching out for. One is the run-out period, making sure there's no new lasers, that there's renewal caps, and then mirroring provisions. And Andreas and John really get into these in the show that follows. And then last piece of advice, number 4 piece of advice, watch out with the eligibility. So after we run through the advice portion of this podcast, I ask Andreas, by the way, this whole intro is turning into a giant spoiler alert. But after the advice portion of our broadcast, I ask Andreas and John what the biggest mistake they see plan sponsors make is. And they both kind of agree it's not balancing risk and expense particularly well. Andreas mentions how he was talking to an executive at a stop-loss carrier who, in a moment of weakness, as Andreas tells it, this executive revealed that he was shooting for a 30 to 40% margin on the policy sold. So yeah, buying too much stop loss year after year means that the plan could be spending millions of unnecessary dollars for too much insurance. On the other hand, worrying too much about price and skimping and then finding oneself or underinsured when that big high-cost claim comes through is also not good. I'm summarizing some big wisdom from Andreas and John, as I said, so do listen to their thoughts. After this, in the show that follows, we get into the now what? Knowing all of this, what is actionable that we didn't cover already? And in short, we circle the wagons around getting into a collective and using a so-called panel approach, which gets explained. Then last but definitely not least, because you hear this on one after another Relentless Health Value episode. I mean, you ask anyone for advice and this one comes up. I was saying earlier, the get a great consultant was the one rule to rule them all. But this last one might be kind of like hold my beer on that one. Know how everyone is being paid, from your consultant to the collective to the stop loss carrier and or their brokers. Get these disclosures. Watch for things that don't have to actually be on the disclosures. And sometimes you can sort of figure these out when somebody seems like they're moving a little wonky. Ask lots of questions. So as I have said 7 times already, today I am speaking with Andreas Mang, who is Senior Managing Director at Blackstone and CEO Equity Healthcare. I am also speaking with John Camire, who's also over at Blackstone, John is Managing Director and CFO, Equity Healthcare. John is an actuary and he runs their stop loss program over there. So yeah, I'm very pleased with myself for getting the likes of these two to talk with you today. Normally, right now, I say, my name is Stacey Richter. And then I say, this show is sponsored by Aventria Health Group. What I'm going to say today instead, though, is that this show is also sponsored by Havarti Risk, which I am so thankful for. The show, Relentless Health Value, actually does cost an unexpectedly large sum of money to create and produce. So I always appreciate when somebody offers to sponsor a show or help sponsor a show. Havarti Risk empowers healthcare leaders like you to make smarter decisions that increase quality and lower the cost of care. Havarti's cutting-edge approach combines deep industry knowledge and also actuarial expertise with advanced technology to transform how you manage risk and optimize performance. I mean, look, when you're putting patients over profits and trying to manage that quadruple play that we talk a lot about on Relentless Health Value, you need partners who understand both the clinical and the financial sides of healthcare risk. To that end, I go a ways back with Keith Passwater, who's the CEO of Havarti Risk, and moderated a panel a couple of years ago that he was on at the Society of Actuaries, right? So I got myself invited to the Society of Actuaries meeting. And that panel was entitled, Can Health Actuaries Make the U.S. Healthcare System Better? And I have to say, I really appreciated the thoughtfulness that Keith came into that conversation with. And in short, yeah, there's actually a lot actuaries can do to make the system better. If anyone can do it, let's get their big brains in on the mission. So yeah, call Keith Passwater, call Havarti Risk. There will be links in the show notes. I really appreciate them stepping up with some dollars to support this pod and keep it on the air. And with that, here is my conversation about stop loss with Andreas Mang and John Camire. Andreas Mang, welcome to Relentless Health Value.
Hey, Stacey, thanks for having me and thanks for having me back. Happy to chat about stop loss with you today.
It is a pleasure to have you back. John Camire, thank you so much for being here today.
Thank you, Stacey. It's a real pleasure.
There was a part one to this discussion, and one of the things that came up loud and clear in that first part is to make absolutely sure if you're a plan sponsor, you have a broker who at that point is probably an employee benefit consultant who is really experienced in the plan sponsors, their exact size plan, their exact type of plan. There's just so many complications that may be relevant to a very specific size employer. So that's the first thing. But beyond that, I'm going to ask John this question. What are the pieces of advice that we really, really need to take on board? Like, what are the best practices that the best employee benefit consultants and plan sponsors are putting into practice as it relates to stop loss coverage?
So first of all, they may think going to 3 companies like they did for medical, makes sense. But this is a broader market. It's a unique market. And there are carriers getting in and out all the time. And so you really need to market broadly. And by that, I would say several carriers at minimum. So that's one thing. We see companies not marketing stop loss even at all in a given year, and that's just a mistake.
And so when you say marketing stop loss, you mean getting bids from?
Yes, getting quotes each year, comparing contracts. Different carriers may offer different types of contracts. I think that leads into the next thing, which is really make sure you know what you're buying. Do not buy solely based on price. For a company that's new to self-insurance, you may be eager to wrap up a lot of decisions earlier in the year. A lot of companies, they're doing their work July, August. They're figuring out their plan choices, their carrier choices, their contribution strategy. They're getting their materials ready for open enrollment. And stop loss decisions tend to come later. So you've already done your budget. You've already locked in things you want to do around contributions. You're printing materials. And stop loss decisions don't really even start to pick up until November. At that point, you might have already had open enrollment. And let's say the stop loss market is telling you it's going to be more expensive than you thought it would be. You might be inclined to pick something that's cheaper than the average plan being offered. And in that way, you might be choosing a contract type that's going to leave gaps in coverage. And that's something a year and a half later, when the claims are starting to really roll in, you could really regret it. And with stop loss, it's really a risk management tool. So it's those little gaps that you leave in the coverage that you ultimately may come to regret.
The question that you answered, John, is what are the pieces of advice that we need to really take on board? And it sounds like an important one is to make sure that you've got a series of quotes that you're getting every single year. It's not just go back to the same, right? Like you have to kind of see what's going on out there in the market and then know exactly what you're buying. You mentioned the gaps, these unknown unknowns. Are there unknown unknowns that you kind of want to point out here? Because they're known unknowns if you've been doing this for a while.
Yeah, look, I think when you're making the decision, they're going to put some quotes in front of you and there's a big long spreadsheet. Some small little area, it's going to say contract type, something like 1215, 1224, something like that. You don't really know what it is. You don't ask any questions. You just keep going. Well, I'm going to give you an example of a company that we recently got involved with that had a 1215 coverage and why that's a problem. What that means is it's going to cover claims that were incurred for the 12 months of the policy period and anything for 3 months after the policy period that gets paid 3 months after the policy period. So 12 months of the full calendar year is the incurred period, and then 15 months, which is the 12 months of the incurred period, plus 3 months of run out in the following period. Well, what happens if you have that premature baby born on December 30th and they're in the NICU? Well, it's very unlikely that that baby is going to be out of the NICU, have all the claims submitted, have all the claims processed, have all the claims paid in the next 3 months and a couple of days. And what happens, this company was actually smaller than we typically see. There was about 200 employees, so not a large plan at all. And the way the contract is built is anything that gets paid after March, they would have been completely on the hook for. So in this situation, this premature baby did not happen, but the risk is that if it does, those premature triplets are in the NICU for 9 months or whatever, all those dollars are completely uncovered by the stop loss policy. Now, if they had bought a different policy, like I was saying, 1224, now they have a year of run out and you're closing that gap to a much, much greater extent.
These terms, 1215, 1224, they sound very esoteric, but they're really important because exactly like with laser claims, once a high cost claimant is identified, if you cross a plan year, now it's a known quantity and nobody's going to insure that quantity because there's 100% risk and no one's going to take that bet.
Yeah, and what you want to do is you want to weave policy periods together with coverage that aligns exactly so that there are no gaps there or they're absolutely minimized. And, a good experienced consultant is going to do that. I think the comment that I want to make why you chose that shorter contract, that 1215, a 1215 contract is cheaper than a 1224 contract. So as I said, you've already locked in your budget. You're making a decision late in the year. You may imprudently choose the 1215 because it's saving you $100,000 on the premium.
So you have to make sure that you have some kind of coverage to cover those known claims if they cross a plan year, which, yeah, sure, I can certainly see how that's going to be an unknown unknown until it happens to someone.
I want to reinforce, this goes back to what we've now said 100 times, the importance of your consultant, your broker. In this one case, when we shared with the CEO, do you know that you potentially have unlimited upside, unlimited exposure? He said, well, my broker told me we were totally buttoned up, right? This goes back to, this does get weedy, this does get complicated. And, we don't expect the people in HR and even sometimes in finance to fully understand the intricacies of this. And so the importance of having someone there who knows how to do this, who has the experience and structures you in a way to protect you from that catastrophic loss is super important. In this case, their broker told them that they were structured properly. And, to our horror, they were not, right? And so we had to do some tap dancing there and some fingers crossed at the end of the year that there wasn't something like a preemie baby at the end of the year. And thankfully there wasn't. But for a while there, who knows?
So basically what you're saying is 1215 is a little maybe precarious. Is that what I'm understanding?
Well, isn't there some situation where it could make sense? So, John, why is that even offered?
I think it's largely offered because there are companies that are selecting it, but I'm not sure that the companies that are selecting it are doing it based on price, not doing it based on risk. And I think in situations of stop loss, I think a lot of times you want to think risk first and cost second.
What I'm really understanding here is that there's always going to be uncertainty. I mean, that's what insurance is. It's figuring out how to balance, how to navigate uncertain terrain, which is not going to be eliminated, and kind of buy down the uncertainty to a palatable level such that everyone feels confident here. And that does take experience, which kind of, again, goes back and points to the making sure that the consultant is really good.
It does.
So we talked a little bit about the 1215 might be a little bit light. Think about 1224. And we talked a little bit about the kind of the structure of the contract. What else do we have?
Yeah, so let me hit three quick ones here. So common provisions in purchasing stop loss contracts where, it's being done by people who kind of know what to look for or have the volume to extract better terms. First is no new lasers. So that can be a provision that once the policy is written, that you can't introduce new lasers despite what's happening in the risk pool. Second would be renewal caps. So caps on what the subsequent year's increase could be. So it's not limitless and unending in terms of upside. Third, really important, is something called a mirroring provision, meaning that the stop loss contract has to mirror the medical plan's coverage provisions. So where you may say, look, we're going to cover whatever, infertility, they can't say, well, we're not going to cover infertility. So those are three really key contract provisions I just wanted to make sure we had in there.
Yeah, I can definitely see how you don't include any of those, that you could wind up with a bit of a mess on your hands. So for our contracting provisions to make sure that we include here is to really watch the 1215, maybe consider 1224. But, obviously price is an issue. So again, you really need to have a broker who knows what they're doing, how you're structuring this whole thing. And then the last three that you just mentioned, Andreas, no new lasers, making sure that there are renewal caps there, and then also the mirroring provisions. Is there anything else that we want to put in our advice list?
We haven't touched on this one yet, but I do want to, something I'm eager to talk about, and I touched on it last time, is eligibility. So companies, when you're self-insured, you have to be really on top of your eligibility in terms of who's eligible for your plan, and are you covering people who are supposed to be on your plan? So the 27-year-old kid who's still sitting on their parents' plan, hey, guess what? They're no longer eligible. That 27-year-old kid has a catastrophic claim, and it comes in. Who do you think's really, really good at eligibility? I'll tell you what, the stop loss carriers are really, really good at eligibility, right? $1 million claim comes in. They're going to want to make sure that that person who they're about to pay a huge amount for is eligible. And if they're not, guess who gets to pay for it? You, the employer. And so whenever we talk about things like eligibility audits that can make some employers uncomfortable, they worry about creating friction in their workforce. Well, I'd be careful, right? Because Murphy's Law is that when one of those catastrophic claims comes in, if you haven't been really fastidious about eligibility, that person's not eligible, you're going to be on the hook for it. Then that is a very bad outcome.
Yeah, I will say I probably spend a little bit too long on the insurance subreddits on Reddit, and probably every day there is this question. Somebody writes, "Hi, I am 32 years old and I'm still on my parents' plan and no one has noticed. My claims are being paid, so ... right? Like there's a lot
dangerous
of
game. It's a dangerous game.
It's risky.
Yeah, well, I mean, from the plan member perspective or their kid, they're thinking they just won the lottery because they have their coverage, and you should see the replies. Why wouldn't you just keep doing it? Like if you're thinking about it from just a rational, I'm trying to save money and I'm 32 years old, I can barely afford my rent perspective. Like, why wouldn't you? It's just, they almost look at it like I'm also on my mom and dad's cell plan.
Right. And I would say that when we have had companies do it, and we certainly have had dozens, it averages, I'd say 2-3% of the dependents that are on the plan are not eligible. And it varies by company. Some do a better job of staying on top of it than others, but it's a real amount. It's not, 1-2 people. It's in many cases hundreds of people.
Yeah. And it's one thing if, I guess, you're paying kind of like for some 27-year-olds or 32-year-olds physical every year or whatever. But to your point, if something terrible would happen, now it's really bad for everybody because suddenly that individual is not going to have their catastrophic claim. They're not going to have coverage, or the employer is going to wind up paying for it. Either one is, probably suboptimal for somebody.
Right. It's the worst possible time for something like this to happen, whether it be to the company or to the individual.
Okay, so back to our main list here. Pieces of advice when it comes to stop loss coverage. If you are a self-insured, pretty much anybody. Here we go. We started out talking about the importance of the consultant or broker. And then we talked, secondly, get bids every single year, multiple bids. And then after that, contracting provisions, including the runout period. No new lasers, making sure there are renewal caps in there. And then also the mirroring provisions. And then the last piece of advice is number 4, watch eligibility and really make sure you're doing eligibility audits. That's really, really a big deal. Okay, so now, do we have any examples of where things went wrong? And I would prefer not getting an outlier here. Just what do you see when you onboard a new plan frequently enough relative to their stop loss coverage or lack thereof?
Well, I think there are the risk terms, like the contract terms. But honestly, the thing I see most often is an overly conservative point of view in terms of stop loss. Stop loss is a high margin product. If your deductible is too low and you're not increasing it on a regular basis, if you just haven't marketed it and you're just taking premium increases year after year after year, we see companies that are just paying hundreds of thousands, if not millions of dollars more than what a, probably market rate policy should be paid. And as much as, the contract type might create risk and there you have unbound liability potential, if you're paying $1 million more than you should be paying year after year after year, in many cases, that's even worse.
John just touched on something important. And I got to know the CEO of one of the large stop loss carriers pretty well. And maybe in a moment of weakness, he revealed to me what the margins are, what they shot for. And this particular company shot for 30 to 40% margins on stop loss. And so John just said it's a high margin coverage. Now I get it. They're taking on a lot of risk. I get all that. But as the employer, you need to play the game, right? Your job is to extract as much of that back as you can and try to get the best coverage at the lowest rate. And too many companies fail to be active purchasers in this field.
So is there a way that you recommend for purchasing stop loss insurance? So we talked about definitely the things that you want to make sure of when you are buying stop loss, but relative to like purchasing it from the process by which one procures the stop loss to begin with, do you have any suggestions there?
Well, in our case, we actually take advantage of a panel approach. So we have a multi-insurer panel who annually is competing for a very large block of overall stop loss premium every year. And that has helped us in terms of getting the best rates possible. That ensures that every year our companies are actually going to the market, as John said, and allowing competitive forces to play in your favor. And so I think that's one way to go about this, as opposed to just kind of going out to the market on your own every year and hoping you do the right thing. Take advantage of volume. I think we're going to talk about this. Maybe take advantage of a collective, as we do, to try to allow market forces to work in your favor.
So this might be our last really big piece of advice. Try to aggregate as much volume as one can, such that when you go to a stop loss carrier, you can leverage that volume of business and try to get a better rate. And you're calling that a panel approach?
Yeah. So, the panel approach, it's important that each individual company is individually underwritten. But when you have 50, 60, 70, 80 companies, all competing under similar terms, all competing in a dynamic where every bidding carrier knows that they're up against a lot of competition, the pencil stays sharp, the contract terms that they're bidding on are consistent, the process is consistent, the results end up being just an added efficiency. And then ultimately, there's a lot more strong choices to be made. As I said earlier, carriers are getting into the market, carriers are getting out of the market. Some years carriers are excited about stop loss, some years they're not. And so by looking at a panel and getting, 7, 8, 9, 10 different carriers bidding for your business, you know that what you're getting is relatively the best in the market that they have to offer.
So does the panel refer to the number of employers that are ganging up together, or does the panel refer to you're asking a lot of different stop loss carriers? Like, who's the panel here?
In this case, it's a panel of stop loss carriers. So in our case, we use 9 or 10 carriers that all understand, hey, there's a lot of different companies here to be bid on. If you can stick to this process, if you can bid on this contract type, if you can, manage claims effectively throughout the year and work with us on that, that's our panel approach.
All right. So in part one of this episode, we have talked about what stop loss is. We've talked about these terms that wind up getting bandied about relative to stop loss a lot of times. We've talked about today the advice that you have, and we just finished up here with the buying process itself, which sounds like, again, there's probably better or worse ways to do this. And I just keep thinking about what you said at the very beginning, Andreas, about making sure that the consultant knows what they're doing. Is there anything that we neglected to talk about that we want to bring up today?
The one thing I wanted to add is make sure you know what your consultant is getting paid. And if you're using some type of collective or captive or whatever, make sure you know what they're getting paid. Over the years, we've seen some, questionable behavior when it comes to commissions on stop loss because it's not an employee benefit. It's not reported on 5500s. If you have that reputable broker and you're doing disclosures and things like that, you're probably okay. Same thing with a strong collective. Definitely know what these people are being paid on this coverage.
Andreas, anything that you want to add as a wrap up here?
No, I think we covered the waterfront pretty well. This stuff is complicated. I hope it doesn't scare anyone away. I hope this helps clarify some of the important points that you need to look at. And it's a really integral, important part of the overall self-insurance equation that is too easy to sort of view as that last buying decision that we talked about and sort of you want to sweep it under the rug. It's probably one of the most important buying decisions. Unfortunately, it happens at the way end of the process when everybody's really tired and beat up and you got to hang in there and get through this one and put as much into it as every other part of what you've done to sort of structure your plan for your employees.
Andreas Mang and John Camire, thank you so much for being on Relentless Health Value today.
Happy to be here. Thanks so much for having us.
Thank you, Stacey.
Hi, I'm Keith Passwater, CEO of Havarti Risk. Relentless Health Value has consistently challenged the way I think about the business of healthcare. The conversations are smart, relevant, and grounded in the realities we face every day. If you're as passionate about driving healthcare change as I am, I really encourage you to follow Relentless Health Value on LinkedIn and join the conversation. Thanks for listening.